Hello and welcome to the latest in our Alliance Live interview series. My name is Sarah Redmond and I am the Director for Development and Improvement at the Health and Social Care Alliance. I am very pleased today to be joined by Angela Leitch, who is the Chief Executive of Public Health Scotland. Public Health Scotland was set up to ensure that Scotland can tackle public health challenges both of today and of tomorrow, and with an aim of ensuring that everyone has and can enjoy their right to health. And it was founded in April 2020, and one of the things we'll be reflecting on, of course, is the COVID-19 pandemic, but also given that Public Health Scotland has recently published their first annual review and along with the delivery plan, some of what Angela sees as the priorities as well for tomorrow's challenges and opportunities. Angela, welcome. Thank you so much for joining us.
Hi, Sarah. Lovely to be here.
So I would imagine that many people across Scotland might not know the full breadth of the role which Public Health Scotland has played during the COVID-19 pandemic. And I was wondering if you could take us through what you see as some of the key headlines of that role and any lessons that you have learned along the way that this past 18 months has shown us.
Okay, thank you. Yes, well, as you've said, Sarah, we came into being on the 1st of April 2020, and that followed quite an extensive review of public health. And I know that the Alliance and your members contributed enormously to the reform of public health in Scotland, so thank you all for that. I think before we go into just what we did over the kind of initial 18-20 months of our existence, it's probably worthwhile just reminding everybody that we are a national health board, but we're uniquely sponsored by the two spheres of government. So Scottish Government with the policy, strategy, direction, and local government in the form of the umbrella group COSLA. And those two sponsors are absolutely pivotal to us because on the one hand, we can support, advise and influence the policy side of things, and equally support on that delivery aspect that local authorities with their community planning partners are so important to across the length and breadth of Scotland. So some of the work that we've been doing, and I'm sure that most of you will recognise the Public Health Scotland logo and some of the work that we've been doing as a result of the provision of data on the state of the pandemic. For months now, we've been supplying Scottish Government with the data. We've been publishing it on our daily dashboard. We've extended our dashboard beyond COVID into vaccinations, into wider issues in terms of public health at a local level. And that has really helped us to establish a presence, to establish our recognition of the brand, as it were, and to have more and more people to come and ask to work with us, to offer to collaborate and share their resources with us in a way that will really help advance the public health priorities that the reform agenda established. So the provision of data, intelligence, evidence and research has been one of the key things throughout. We've obviously provided a huge range of professional advice to support the government decision making throughout the various phases of the pandemic. One area in particular where we made a significant contribution was in the provision of expert guidance on the return to school and further in higher education, again using our data, being an evidence-based organisation to support those that were delivering direct services to children and young people. And that we've had some fantastic feedback for that, and it's testament to the work that the teams have done. I suppose other specifics, Sarah, are the work that we did on contact tracing. That again was done on a national and local basis. That was absolutely critical, and it continues to be critical in addressing the virus and managing the virus. We've developed with the board arrangements for mutual aid, and we've also done Once for Scotland approaches with a whole lot of innovations and digital adaptations that we would never have thought possible at the outset. And increasingly now, we're doing a lot of work on vaccinations, particularly with NHS Education for Scotland, working with third sector groups on vaccine inclusion, vaccine confidence for minority groups, and providing public materials to support the uptake of the vaccine. And that's only a flavour of some of the work that we're doing, because there's a raft of other ongoing work which has continued, although we've stopped some. There is ongoing work such as work on drugs, alcohol, tobacco, food, you name it, and we are involved in it. I'll just briefly touch on the lessons learned then that you asked about. And I mean, what a powerful start we've had in Public Health Scotland. And when I took up the role in November 19, the pandemic really wasn't featuring at all at that particular point. So we had plans to do things very differently, as you can imagine. But I am in the camp of viewing COVID for us as an opportunity, because we saw how agile both PHS and other organisations could be, moving really swiftly to support people, homeless people, thinking about digital learning for children, support for those who are shielding, and the third sector played an enormous part in that, really breaking down barriers that would probably have existed previously, and thinking about, organisations that would have tended to, do particular pieces of work that then moved into completely different areas. So I think that that's been so powerful. I think the way that we intuitively prioritised what needed to be done was a real strength. And I think if we can keep hold of that, so that we can think about how we can apply that in terms of addressing the inequalities that we've seen really sharply through COVID, that would be an enormous boost for the country. And I suppose a couple of other things, just very briefly, we had to stop doing some work because we had to ask people to move into dealing with the response and giving the guidance and advice that was so badly needed. And, while stopping some work seemed, a real risk at times, 20 months on, we're now thinking, does that work really make the difference that we want it to make? Or could we use that resource very differently? So I think that that's another opportunity that's enabled us to reflect in a way that perhaps we wouldn't have had before.
Some really important lessons learned, I think. And you touched upon the the sharp rise in inequalities, which is has been rightly talked about as a kind of consequence of the measures that needed to be taken. And I guess one of Scotland's biggest challenges around public health is making improvements to our to population health more generally, and particularly to those people who face societal barriers or systemic barriers to achieving their right to health. And I know that's that's kind of core to the mission that you have as an organisation. And so I'd be really interested, thinking about some of those lessons and I guess over the last 18 months, what you have been learning. What do you feel needs to be part of our recovery efforts, in order that, we really maintain that important focus on addressing health inequalities?
Yeah, and there have been some, really powerful lessons that I've talked about. I think critically through COVID, we have seen just how a virus such as this has really impacted on those that are least advantaged. And I think that that's a fundamental, that it's always been there, but I think that it has really brought it to everyone's attention. So tackling that poverty and inequality, which I know we're all committed to already, has to be a shared priority across the system in Scotland. I think I am really excited about the COVID recovery strategy for a fairer future, and it was published in October. I know the Alliance and your members will be well aware of it. And I think it does set out an ambition to achieve a fairer and a more equal Scotland post-COVID. And the highest priority in that, as you know, is tackling child poverty. And that's one of the aspects in our plan, and it's also uppermost in our sponsors, Scottish Government and COSLA. COSLA's blueprint talks extensively about the work that local government are doing on child poverty. And through that, the third sector organisations that are very much part of that work at a local level. We know how important taking care of our own health, thinking about how we prevent ourselves falling into poorer health is so important. So we're working with a range of partners in that. So very much upstream work with Sport Scotland, for example, on physical activity, Skills Development Scotland, on the importance of everybody having skills, a job, a reasonable income. And we're working with other partners, Scottish Water, Food Standards Scotland, the universities increasingly, and obviously the Alliance, because you've been doing some amazing work with some of our teams. So I think that in terms of recovery, it is about recognising the skills and expertise and resources that we each have, how we can address population health to build back fairer. As you say, I think people actually appreciate what population health is in its widest sense. So it's not solely, although important it may be, about disease prevention or control. It is about thinking about how we help people to have a good standard of health and well-being in our communities. And there are so many partners that contribute to that. So I think in terms of going back to the strategy, the recovery strategy, I'm really behind, and as is our strategy, the financial security for low-income households, prioritising the well-being of children, and having good green jobs. And I think the word prioritising is really important, because if we can all overtly come together, behind these and state what we individually and collectively will do, then we'll be able to see how we can progress things.
Thanks, Angela. It's so welcome to hear you speaking so powerfully about the importance of those social determinants of health, because I think that's the kind of leadership I think that we do need when we're thinking about the transformations around our health and social care system, thinking that much broadly about what else contributes to health and well-being. And you've touched already upon the role that the third sector has made, both to the COVID-19 response efforts, but also more generally to Scotland's public health and population health initiatives. And one of the things we often hear from the third sector and from our members is that it can feel quite challenging working, achieving that aspiration of equal partner, both strategically and at times at a delivery level. And I'm just wondering, in your opinion, how do you feel, or what do you think we need to do to really deliver on that ambition of kind of collaborative leadership and equal partnerships across sectors?
Yeah, and it isn't something that's new to me, I have to say, because I did many years in local government, worked really closely with the third and community sectors, TSIs and the like, and I absolutely appreciate some of the fantastic work and also some of the challenges that the sector faces. So I'm coming to this from that perspective. And I think, I've seen some really powerful work where third and community partners have been instrumental in taking some policies to a new level, really joining things up in a way that statutory organisations probably couldn't see or fully understand. And I think that's because you're so close to, or many of you are so close to working with the people who who need the support, who are in our disadvantaged communities, and then taking that experience and helping us either at a national or at a local level to really understand it, so that we can alter practice, or that we can take advantage of new opportunities to really coalesce around individuals, rather than, as perhaps was the case in the past, and hopefully less so now, where we tended to look at the issues that the person was presenting with in isolation from the others. So we weren't taking that person-centred approach, and neither were we thinking about how we could take responsibility for joining things up so that that individual wasn't being passed from pillar to post. I think that there are opportunities now to start to really think about the regeneration of our communities, and whether we're in a regeneration zone or not, or whether that's part of our remit, but there will be a contribution that we can make to helping our communities to thrive. I think the final bit on the collaboration is that I know that, again, from experience, the role that third sector plays in community planning, and I am on record as saying if community planning partnerships didn't exist, we would have to invent them. And I think that I know that there have been, people who have been critical of them, and my response is, but we're being critical of ourselves then, because we are that partnership, and if it's not working, what are we doing to improve it? And I think that collective responsibility for continuous improvement is something that we all have responsibility for, and I think that we need to bear that in mind.
Thanks, Angela. Now, this question might feel a little outside the box for you, but I guess given your experience, as you were describing, working in local government and also now within Public Health Scotland, if you were, if we were seeking to redesign the health and social care system, from scratch, or we didn't have the constraints perhaps that we sometimes have around, well, this is always the way we've done things. Taking a public health approach, what would be your 3 priorities? So
I think in our plan, we've set out some of the priorities that we have, and they're not dissimilar to the COVID recovery strategy, I have to say. So I do think fundamentally we need to think about prevention, and I think that my response would be that we in health and social care need to make sure that we engage with the wider sectors, because we need to make sure that we are taking a much more holistic, whole system view of the drivers of health and well-being, and that view that has people and citizens at its heart, that I mentioned earlier. I do think that place is everything, and we need to recognise that local communities face different challenges, and again, that's where the power of the third sector working with the local statutory bodies is so important. So I think that we all then need to make sure that we've got the collaboration, that we've got the relationships with a variety of different stakeholders that go beyond health and social care, if we're really going to address the fundamental issues that result in poorer health for some of our communities, some of our citizens. And I do think that tackling low income, it has to be really, really up there. And associated with that is obviously security and housing, and how can we make sure that people have decent, secure dwellings to live in. That's especially important for the well-being of our children and young people, and if we can get it right for children, the GIRFEC approach, getting it right for every child, then future generations, we might see a shift in some of these really persistent health and trends, health and wellbeing trends that we've seen.
Thanks, Angela. Okay, and I guess if you would be able to offer, because you mentioned earlier about the importance of decisions being, citizen-led, and the delivery plan makes reference to, decisions being taken as close to communities as possible. And I'd be interested, and I think, the work of our members is often very heavily led in a similar way, being, working in collaboration with people and the lived and living experiences that they have. And I wonder if you could take us through, how Public Health Scotland is kind of taking that work forward. What kinds of, areas of action are you taking forward in that respect?
Yeah, and I have to say that we are really working with others to strengthen that approach. So we're recognising that, we don't have all the answers, absolutely not, but that there are other agencies that are much closer to people who have experienced those challenges in their lives than we have. And I know that recently the Alliance has done an amazing piece of work with us on gambling, for example, and that has taken a lived experience approach, and there's other ongoing work in terms of the use of libraries. So fundamentally, having people who have come through those difficulties and had to navigate the system is going to be so important. We're trying to build on what's already there rather than establishing things that are duplicating or replicating what's already in existence, because that doesn't make the best use of our resources. So, for example, we've got a youth panel just now, hopefully we'll get together at some point, where we're really thinking about mental health in particular, and how young people are telling us it is for them, and what we as a public health agency can do to support them, but not just us ourselves, but what then can we then take into other parts of health, or our colleagues in local government, or indeed community planning partnerships and TSIs and the like. So as we've done in the past, we will be reaching out to individuals, and increasingly people are reaching out to us to say, we are doing this, we are concerned about this, is there an opportunity for us to join resources to look at this together? And within the proviso that I am keen that we look at how we prioritise this work in line with our strategic priorities that we've set out, but importantly with the ones that we're seeing now coming out from the COVID recovery strategy, then I'd be delighted to take on board the feedback. So I think that we're really keen to think about these partnerships on a whole range of different levels. And I think the other bit about the Alliance and members in terms of addressing the public health priorities is being at that. There's so many at the delivery end, I know that not everyone, but so many of your members will be able to see what the barriers are to more effective working. And we've seen that through that paper, that report that we did on gambling, for example. And the more that we can then reflect on that and feed that through the various systems that we're operating in, then I think the more that we can collectively break that down and think about doing things differently.
Yeah, absolutely. I think there's so much of what we can do together in terms of generating those insights, but also, as you're saying, identifying what the barriers are, and really focusing on how we implement this in practice. Well, I mean, this has been so interesting, and thanks for your time, Angela. And I guess just a last question to you is, reflecting on that last point and what we've talked about today, and the way, the opportunity that, it poses for Scotland having a national public health body, and realising the contribution that the third sector makes to that. Is there anything else that you would want to share in terms of, how you feel the Alliance and our membership can support Public Health Scotland in meeting Scotland's public health priorities?
Yeah, and I mean, I think that some of the work that the Alliance and the your members, in conjunction with others, is doing across the country is just incredible. And I can say that from my own personal experience. I think the key for me, and I'm a bit of a broken record on this, is that we do all need to share and we need to work together to really drive towards specific action, and use opportunities where they present themselves to join our services, because otherwise we won't have the impact that we really want. So I think that there is an opportunity now. I think that we have seen as I said at the beginning, the agility of the way that organisations, and especially the real flexibility that there is within the third sector to move at pace, to really respond very intuitively to people's needs. And I think that that's really where we have to build and think about how we can use that, not lose it as we start to recover, hopefully, and think about those who are most disadvantaged in our communities. So I look forward to that continued relationship, Sarah, with the Alliance and your members.
Thank you, Angela, and thank you again for your time today.
Not at all. Thank you.